Lesson number 8, Introducing Pulse Oximetry. By the end of this lesson, you should be able to describe how pulse oximetry can be used to measure pulse rate. Your heart pumps oxygenated blood around the body. As the blood passes through the arteries, they expand, and you can feel this as a pulse. If you put a finger against the artery at the wrist or in the neck, you can record the number of times your heart beats per minute, your pulse rate. On average, your heart beats around 70 times a minute. If you want to record the pulse rate more accurately, or over a longer period of time, you use a device called a pulse oximeter. This can measure two variables, your pulse rate and how much oxygen is in the blood. Pulse oximetry is a simple, non-invasive, and continuous method of monitoring your heart rate. It is often used for patients during an operation, when they are under anesthetic. It can also be used to determine whether a person has a disease that affects the blood. Some pulse oximeters display waveforms of your pulse. Some emit a sound if the pulse rate is too high or too low. Oximeters are also able to detect when a patient has too little oxygen before they show any visible sign, such as the lips turning blue. A probe is placed on the patient's finger or earlobe. For babies, probes are often attached to the foot. Some sensors are disposable and are used just once. Others are cleaned with alcohol solution and ready for the next patient. A pulse oximeter consists of a light-emitting diode and photodetectors. The LEDs produce beams of red and infrared light which pass through the body tissue, such as a finger, and are then detected by the photodetectors, which measure the intensity of the light. There are two types of pulse oximeter. The most common type has the LEDs on one side of the tissue and the photodetectors on the other side. An alternative type works by reflection. Both the LEDs and the photodetectors are on the same side of the tissue. Light produced by the LEDs move through the tissue and is then reflected and detected by the photodetectors. During a pulse, the arteries stretch, their volume increasing in the moment after the heart contracts and pushes out blood. As the pulse of blood passes through the beam of light from the LEDs, the blood absorbs some of the light and the photodetectors receive less light, so the reading changes. Each change is detected as a pulse. The LEDs do not shine continuously, they flash. During their off time, the pulse oximeter measures the light level in the room and allows for this when displaying a reading.